Just around 50% of adults report meeting aerobic physical activity guidelines, and that has remained relatively consistent over time. When we add in the strength training portion of the guidelines, we see that percentage drops to around 20% of the population. Why is it that despite valiant efforts by many physical activity researchers, we haven't been able to budge this? I'm going to talk to you today why my research shows that engaging in a community is key for sustaining both physical activity and exercise behaviors. In 1978, Robert Butler stated that if we could pack exercise into a pill, it would be one of the most widely prescribed and beneficial medicines in the nation. Now, some have tried to do just that, but I'm here to tell you that we have to actually engage in the behavior to see the benefits. And the benefits include physical health, mental, emotional, and social health, especially if you engage as part of a community. But let's take a step back to my childhood. When my sister and I were young and my parents played volleyball, we were in car seats, they would take us and they would put us under a table so that the volleyball wouldn't hit us, and it never did. Some of my fondest memories of when I was a child are from being active with my family. We would go on walks in the neighborhood cemetery, which was a safe place for kids. We also would go on hikes. We would play a lot of different ball games out in the yard, including hitting the volleyball around ourselves as we got older. When I was 5, my mom and dad enrolled us in gymnastics at the local YMCA. And that was my first experience doing physical activity as part of a team. And I continued to increase my sports participation, and I continued that participation when I got into college. And it was when I was in college that I took a class called sports psychology. In this class, I learned about one of the first sports psychology studies ever done. It was done in 1898 by Norman Triplett, who at that time was in the field of social psychology. And he was interested in this phenomenon where he would have cyclists in the lab pedaling by themselves went much slower than when they were cycling with others, despite the fact that they didn't feel like they were cycling any faster. And he labeled this phenomenon social facilitation. Now, I finished college and I went on into grad school, and I did what a good responsible adult would be, and I joined a gym. And I worked out on my own. And I got to know other people in the gym, met friends, but my actual exercising was by myself. And it was hard to stay motivated. My fitness didn't really improve. After I finished graduate school and I took my first job at the University of Hawaii, I was introduced to a new type of exercise called CrossFit at CrossFit Oahu. And this was more than just a gym or an exercise program. It was a community. We did the exercises together. We hung out before and after. We brought our family members in and began to see some real changes and improvements in my fitness. So let's talk about a sense of community. In 1986, Macmillan and Chavez published a paper where they defined the sense of community as well as first explained the theory for it. And what I'm going to show you is adapted figure I created for a previous publication using their sense of community theory. First are common interests. This means that people involved in a community are there because they share interests in common, and they bond over this, which results in friendships through social networking as well as group dynamics. Next is social support. That's a key to a lot of different health behaviors. And this is being connected to other people in the group, as well as being encouraged by people outside the group, such as friends and family members, for your continued participation in that community. Next is administrative consideration. This is when those who are in charge, it could be coaches, it could be administrators, they express care and concern over people that are part of the community. And doesn't that feel great when you know that somebody cares about you and is asking about you and hoping that you'll show up and be there in the community? Next are social spaces. If we're going to have communities, we need places for people to interact. Lately, it's been online interactions, such as this online conference, but in a traditional gym sense, it might be a space within the gym for people to bond with each other. It's also important within communities to have diversity. That makes the community better, to have different ideas, different life experiences, different ages together, and be tolerant of each other, but also working to empower each other so that everybody feels like a valued member of that community, not just from that administrative side, but also from the community members themselves. Next are leadership opportunities. Now, you might think of this like in a sports realm, this might be being the team captain, but this is more than that. It's also about leadership opportunities that happen from peer-to-peer support, and these might be both formal and informal opportunities. Then we have the voluntary action. Now, this is really important. This is important because people are not part of the community because they're being forced to or coerced to be there. They're there because they want to be. Last but not least, and this might surprise you a bit, is competition. Now, competition can be seen as something negative, but it can also be very good, especially when it's supportive, because what it does is it pushes someone toward excellence. It's those internal and external influences that push you to excel, but it also helps you figure out where you fit within that community itself. Now, as I mentioned, the community I got introduced to in Hawaii was CrossFit. And when you hear the word CrossFit, this might be what you think of. You might think of the CrossFit Games, athletes going as hard as they can. This is not the CrossFit Games. This is me competing in Dallas a few years back. And then what happens when you're done with those really hard workouts, right? You end up like this. Well, that can happen, but I'm here to tell you that the normal everyday workout looks a bit more like this. It reflects the aspects of a sense of community. So in this picture here, we have members of my CrossFit gym that are working on their skill of pull-ups. And the woman, you can see she's being assisted by an elastic band. The man has a weight hanging from a belt around his waist, so his pull-ups are a little bit harder than usual. And then the other gentleman, who's just using his body weight for pull-ups, is between sets. And he's smiling and he's encouraging the other members as they work through this exercise. And this community extends beyond the gym as well. I want to present to you the framework for my research. So I study high-intensity functional training, and CrossFit is one part of that. In 2018, my colleagues and I published a paper defining what high-intensity functional training, or HIFT, is and how it can contribute to improved fitness. And that definition in the paper, we talked about HIFT as a training style or program that incorporates a variety of functional or everyday movements that are performed at high intensity. Now, that high intensity is relative to each individual. If you think back to the previous picture of the three individuals, right? They're doing the pull-ups at their individual fitness level. And these programs are then designed to improve parameters of general physical fitness, such as cardiovascular endurance, flexibility. It could include body composition, as well as performance, power, strength, speed. Now, one of the things we highlighted in our paper was the importance of community within successful HIFT programs. And we found that this community aspect really was important for people continuing their participation. Now, if part of the definition of HIFT, right, is improving parameters of general physical fitness and performance, does it work? Yes. I and other researchers around the world have published a variety of studies showing that, indeed, HIFT does improve aspects of fitness. In an interesting pilot study that I did with cancer survivors, we put them through 5 weeks of high-intensity functional training program, and we did see that it improved their fitness through physical function movements, as well as it improved their body composition. But one of the neat reminders that happened during this study was that the participants, who were cancer survivors, said, we want to be able to share our stories. We want time at the beginning of the sessions to share what our cancer experience was. And this was a wonderful thing, and they really bonded together. They also pushed each other and were a pretty competitive group because they had beat cancer, but and they had a lot of fun. So fun, right? Exercise enjoyment. It was something that we measured in an early HIF study that we did. We randomized overweight and obese adults to 8 weeks of either participating in high-intensity functional training or a group of who did aerobic and resistance training to the physical activity guidelines. And we measured their exercise enjoyment before and after the training. For the HIFT group, they came in with pretty high exercise enjoyment at the start, and they maintained that through the intervention. The ART group actually had lower exercise enjoyment to start, but they significantly improved over time after participating in the group. Of interest at the end, those in the HIFT group wanted to continue, and those in the ART group wanted to try out HIFT. Now, behavior change is what we're really going for, right? And in a pilot study that we did with older adults, we asked them before they started the 8 weeks of HIFT training, what types of activities they participated in. And as you can see, these activities reflect those that would happen both within a gym as well as in daily life around the household and elsewhere. And what we saw at baseline was some of them, a small percentage, were participating in a lot of these, especially some gardening and walking. But after the intervention, they increased their participation in every single one of these domains. But the neater part of what resulted from that intervention was the group. This strong community of older adults, just like the cancer survivors enjoyed working out with other cancer survivors, the older adults really enjoyed working out with others who were their age and going through similar life experiences. And the neatest part, over half of this group is still exercising with us today, 5 years later. Because we didn't just introduce them to an intervention, we introduced them to a community, and that was a community that they were able to continue. So why is it that people continue with high-intensity functional training? What is it, their underlying motives for doing so, if we had to break them down? So two of the key barriers to doing exercise that have been documented time and time again are lack of time, as well as lack of motivation or lack of enjoying what you're doing. Now, motivation is involved in starting a physical activity or exercise program. It's involved in continuing that and adhering to it over time. When we did a survey of over 700 adults who had been participating in HIFT for at least 3 months, up to multiple years, we had them rate different motives that underlied why they did HIFT. And what we found was those who had been participating longer, as well as those who came more days per week, reported higher motivations for affiliation and relatedness, as well as enjoyment. And so this word cloud here highlights some of the key motives that came forward out of this research. And if you look at those closely, you can see the aspects of sense of community represented within them. So let me give you a formula. If we introduce participants in our health behavior research to interventions that work, so in this case, it's HIFT, we know we can increase people's fitness. But if we add in a supportive community, we're going to find success in leading to sustained behavior change. Now, creating community doesn't just happen. It takes time and it takes intentionality. We have to work on creating spaces and communities within our intervention that incorporate key aspects of the sense of community. We have to show that the leaders care about those who are participating. We have to give them spaces to interact. We have to encourage them to support and encourage each other. And all of these things can help support their behavior change. Now, as health behavior researchers, let's not just introduce people to individual level interventions or exercise programs that we hope they'll continue. Let's introduce them to a community. And while we're at it, we may just find a community to belong to ourselves.
When I was working on my dissertation, I worked down the road from the Red Cross, and I was a pretty regular blood donor. One day, I went down to donate a pint, and I sat in the chair. I was pretty familiar with the drill. And the phlebotomist and I started up a conversation. She asked what I did, and I mentioned I was working on my PhD. She asked what my research area was, and I said epidemiology. And she paused and said, "Well, what are you studying?" And when I looked up to start to explain, her eyes said, "Prepare for impact." I realized in that moment that I had a chance to dazzle her with some technical information, or I could explain it to her in a way that I figured she would be able to relate. So I did and said, "I'm studying the impact of banning smoking in bars and restaurants." She immediately lit up and started telling me that her sister in law was a server in a restaurant and she maintained that smokers were the best tippers. She asked me if that was part of my research, and I went on to explain that tips weren't reportable to the government, so it wasn't a part of my research. But we talked about the local businesses and why this issue was controversial and had a great conversation about it. It wasn't until later that I realized that the name for this action I had performed, connecting someone to research information in an accessible way, it's called being a knowledge broker. As researchers, we're naturally knowledge creators. We examine problems, identify solutions, and hopefully um, understand how to facilitate, make things better. Too often, our research gets loaded down with statistical modeling or jargon or other complex constructs. But when we make this information formatted in a way that's accessible to the layperson, it allows our research that already takes root in human behavior to be much more understandable to people who are already curious about those answers. When we translate our information from this technical theoretical format to a more accessible one, we create the potential for people to use that information to help improve their own lives. A knowledge broker can act in three different ways: to create information, like we do as researchers, to link users to that information, or improve access or build capacity for that knowledge. These are the skills it takes to do a knowledge broker role. And I would like to maintain that you can do this as a faculty member or researcher. In our role, we possess the tools or competencies that are required to do this skill. It requires content expertise in a specific area, analytical thinking to be able to understand the area as well as the needs of the audience, management and leadership skills, and hopefully communication skills to be able to make that translation from technical to non-technical. It helps if you view yourself as part of a team too. I help train the next generation of knowledge brokers with my students in the public health MPH program, as well as with my advisees. We do this through an activity I like to call the Dissemination Challenge. I have the students read an article or evaluation report, and I ask them to prepare a series of social media posts that summarize the key findings with hashtags. This is a very simple activity that my students learn how to do, and the more often they do it, the better they get. This is true for faculty members as well. You can practice this action very easily with the next paper that you write. You might have already done this. In fact, many of the journals we publish in have sections that are required that are called highlights or implications for the field, or even so what. These are essentially brief synopses of research findings that are perfectly organized in a way that are accessible to the public. So knowledge brokerage doesn't have to be your new central role. It can be essentially on the periphery of your practice in something you do periodically, but the effort that you make can have a substantial impact. Let's talk about why knowledge brokerage is not the norm. I've identified at least three key barriers. First, confidence and skills. I hope you can see that you already possess the competencies to do this role as a knowledge broker, so you don't need to reinvent yourself. You just reapply your expertise in synthesizing evidence for the media rather than a research journal. Priorities. Annual reviews and tenure and promotion committees don't always view these kinds of dissemination efforts as a high priority action. But if we continue to park our research evidence in peer-reviewed journals, we perpetuate this slow process of research dissemination. Lastly, the fear of being a self-promoter. In her book, In Selling Science, Dorothy Nelkin documented the unsavory practice of attracting attention to your work as a means to get your own recognition for your ego or potentially for research funding. You can be a knowledge broker without being that self-promoting colleague who uses the microphone at a conference to say, I have more of a comment than a question. So what if we do nothing? The trickle-down process of research findings to get it into communities may move very slowly or indeed may never happen. In the meantime, health information is being sought online. 80% of adults report searching for health information, individuals from all walks of life. If we present information in a way that is a format that's friendly to those with lower health literacy, it might help to meet that desire that's clearly there to access health information. And we can contribute information through a channel that's very accessible and in a format that's useful. When I was finishing up my dissertation research, we created a brief research summary of the findings on the impact of banning smoking in bars and restaurants. We presented it to the state legislature as a part of the consideration for making this a state law. This testimony helped to support the creation of the first statewide clean indoor air policy in the Midwest. So what I learned from sharing my research ideas and some of the concepts with that Red Cross phlebotomist is that when we make the effort to make our research more accessible to individuals or more public facing mechanisms like media stories and others, we improve the reach of our specific research. We also might enhance the understanding of what we do in public health research more broadly. When knowledge brokering helps to become more of a normal part of the work we do, we'll tap into the media to help more broadly improve health. We'll be knowledge creators and capacity builders for both individuals and communities. Thank you.
Most of us in the room realize that our society is inactive, meaning physically inactive. We've been labeled and describe ourselves as couch potatoes. We park closer to our destinations. We get excited about automated scooters, hoverboards, ride machine assisted bicycles, and we sit for the majority of our days. Our kids focus on test preparation in school, being expected to focus while sitting for continuous hours. And there are even images circulating throughout popular media of people driving their dog for a walk. As a kid, I remember running outside until dusk was dawning with my sisters and friends, building forts, chasing one another, or butterflies, or lightning bugs, making up roller skating and dance routines on my driveway, or joining other kids for a pickup game of kickball, or some other game in the field, a yard, the cul-de-sac, or the woods. Being outside, moving and laughing, free, until being called in for dinner, or if it was after dinner, being called in to go to bed. This type of active play is not normal today. Parents are concerned about safety. Is there a safe place for my kids to play? Concerned about unknown people, loose animals. Is there a way for kids to get to a safe place to play? While this scenario is rampant across America, kids growing up in rural communities, villages, small towns, the country, have even greater and different challenges, many times, than kids growing up in urban or suburban America. Let me paint a little bit of a picture for you regarding rural America. Thinking about the last time you drove through a one-stop light or one-stop sign town on a road trip or on your way from one city to the next, I want you to picture what you saw as you pulled up to that stop sign or stoplight. You probably noticed a corner store that possibly wasn't open. Maybe a few homes or evidence that there could be a few homes down the cross street that you were on. But you're on a 2-lane road, most likely without shoulders or a turn lane. You might have seen a few teens walking down a worn path alongside the road since there were not any sidewalks. You also might have had one of the following thoughts. I wonder what people who live here do, or I can't believe I have to slow down for this stop. One of the things you undoubtedly picked up on was the lack of people and resources. Resources of all types are limited in rural communities. Resources for health, economic growth, education, prevention, treatment, you name it. Resources to support active play and physical activity like parks and playgrounds are also limited. There are fewer built places. Schools are oftentimes consolidated in rural areas, meaning that they're located away from where most people live in rural communities, so that everyone has to commute farther and that you only need one school campus to serve a larger area. And kids are often on school buses for many hours one way to get to school and then to come home from school because of this. And while people often think of the wide open spaces and richness that lines the backdrop of rural America, what is often not thought of is the accessibility to these areas, including upkeep and maintenance. Who's allowed to use these resources? The people who live there or the people who are visiting? And how do people get to these resources? Natural resources and space is a strength of many rural communities. However, kids and families are not able to always access and use these spaces, leaving the places closer to home or school as options, with limited programming for youth, which many times means for-pay traditional sports teams with fees, which widens disparities for children from low-income families, kids not skilled in or interested in traditional sports, and oftentimes girls. So why is this so important? Why focus on the roughly 20% of the American population that live in rural communities? Why focus on active play and physical activity for this part of the American collective? Why focus on 85% of the counties that are defined and classified as persistent poverty? What is at stake? There are great health benefits from being physically active on a regular basis, and I'm probably preaching to the choir here. But these range from chronic disease prevention, diseases like cardiovascular disease, diabetes, obesity, multiple cancers, to enhance social emotional wellness with decreased anxiety and depression, increased cognitive function and academic performance for our kids, better connectedness with others. What we know for folks living in rural communities, especially in low-income rural communities and those of color, is that they are already at greater risk than urban suburban counterparts to be negatively impacted by these diseases and health risks. And COVID-19 has highlighted these disparities even more. Recent CDC reports show that over 40% of our nation is currently obese. In some states in the southeastern and midwestern parts of the US that have considerable rural populations and high rates of poverty like Mississippi, Alabama, Oklahoma, they're being projected that they're going to have close to 60% prevalence of obesity by 2030. 1 in 5 school-aged children and young people in the US is obese. Researchers have concluded that rural children have a 26% greater odds of obesity compared to urban children. There's a higher prevalence rates of obesity for rural residents. They contribute to higher prevalence rates of chronic diseases, with the prevalence of heart disease being 1.5% more prevalent in rural areas, with increased rates of cancer and stroke also. But only 24% of kids 6 to 19 in the US report meeting national physical activity guidelines for health of 60 minutes or more of physical activity per day, with an even lower prevalence for girls and children of color. There is something promising. Current evidence is mixed on whether rural kids are as active as urban kids or possibly more active, revealing that there's interest in participation in this health benefiting behavior. Also, increasing physical activity and active play opportunities has the possibility to reduce engagement and risking harmful behaviors in rural communities, where there are fewer healthy, safe options for youth to engage in outside of school hours. Much of rural America is currently struggling with the opioid crisis and has for decades struggled with other waves of high-risk behaviors flowing through the country. In one community in Oklahoma, a number of employees of the tribal authority in the area are astutely aware of the need for healthy and safe options and opportunities for their kids and youth, given the increases they have seen in opioid use and mortality, as well as in suicide and mental illness in their young families, on top of the extremely high rates of diabetes and obesity in their communities. This became even more apparent when the school district in this town of just over 1,000 made the tough decision to move to a 4-day school week to keep their lights on and avoid further layoffs of school staff and teachers. What this did for kids in the community, though, was open an entire day without a place to be when their parents and guardians continued to work to pay bills and feed their families, almost beckoning risky opportunities to knock. Staff at that tribal youth center in town responded to this need by opening their doors beyond their normal before and after school hours on Fridays so that kids and youth in the community had a safe place to be. They provided safe and fun opportunities with open gym play, structured game opportunities, semi-structured game opportunities, connection with friends, while also rounding up donations for healthy snacks like fresh fruit and water to give these kids. One final thing that I've seen over the past few years is the need to bring people together. We need to reconnect our communities, rebuild what was great, and create stronger communities instead of continuing to perpetuate the silos that we're living in among one another. These silos can be even more isolating in rural America, where there's greater physical distance between residents and families. In addition to the inarguable health benefits of physical activity and active play, including the potential for risk reduction, what I have seen through some of my work is the ability for active play opportunities to bring communities together, to remind us of how similar we are. If you were to ask your colleagues, friends, family members, neighbors, if I was to ask you if every child deserved to be healthy, if every child should have the opportunity to run, play, laugh, and squeal in delight through active play, I believe we would find very few objections. The health and vitality of our children, America's next generation, our legacy, is something we can agree upon. It can connect us, bring us together, give us a common ground in which to relate to one another, regardless of how different we might look or sound from one another. This was extremely evident in Play Street's work that a colleague from Johns Hopkins and I have partnered on. Through this project, we collaborated with rural communities to put on Play Streets, a program that uses publicly accessible spaces, could be streets, or could be parking lots, parks, library, school grounds, or fields, and they're activated for a few hours several times throughout the summer. Play Streets have been shown to be feasible and low cost and effective in rural communities. They're open, they're free of charge for any community members to access, and has active play equipment and some adult supervision through volunteers. We saw families driving in from neighboring small towns, kids walking over from homes nearby, and adults talking and connecting with one another. One mother thanked the organizers for providing an opportunity for her 3 kids that she could afford, that allowed them to play, have fun, get some exercise, and see their school friends that her kids hadn't seen since the last day of school. Parents were talking with one another, kids were playing and being active, and multiple community organizations were on site delivering other resources. In Texas, this also included locating a Play Street on the school grounds where a summer meals program served lunch, providing free and safe opportunities for those kids to also connect and run and play for a few hours. Rural communities are strong and innovative. Rural communities are creative. They have grit. Understanding how we can best support rural communities through their uniquenesses and not simply treat them as a small city is extremely important. One, to ensure that our efforts match the needs and context, but to also build on strengths of rural America. All kids matter. Rural kids deserve the chance to grow up happy and healthy. Thank you.